Welcome to the Life After 50 show, helping you navigate the second half of your life. Today's show is sponsored by Find Houston Senior Care, your one-stop shop for everything senior care and senior living in the greater Houston area. Visit findhoustonseniorcare.com today. And now, here's your host, Catherine Watson. Hey, everybody. Welcome back to the Life After 50 show. I'm Catherine Watson. I'm your host today. And today I'm bringing onto the show a dementia nurse, a lady who has been working with dementia patients for a number of years, I believe about 11 or 12. And she has a lot of great information to share with us today. So Gina, if you would just please introduce yourself and tell us a little bit about your background and what you're doing today, because you've started a new venture.
Yes. I've been a nurse for nearly 11 years. It will be that in about 2 months. Kind of fell into the dementia geriatric just by default initially. And then as I continue to work with the population, I realized how much I loved working with them. I really enjoy finding solutions for the struggles that they face daily. And it could change from moment to moment. Somebody who suddenly needs to go home and care for their children. They need to go home and cook dinner. And I love finding solutions for that. So it just kind of became something I fell into, but then decided how much I loved it and I would continue to, and just to have that as my specialty. I recently started a business where I educate. So a lot of the family members that have their loved ones at home don't always know they get a diagnosis. And then they're left with, well, now what do I do? How do I help my loved one at home? Can I keep them home longer? And it's a challenge because oftentimes they just don't know how to handle the day-to-day things that come up. So I had this idea that I could go into the home and actually train the family members how to navigate the day-to-day with their loved one with dementia, with the hope of keeping them home longer if that's possible.
I think that is an amazing idea. I really do. And I know that there's a lot of families that are listening to this broadcast that are probably interested in hearing more about how you help families with this, because it's a big challenge. None of us were trained in dementia. We didn't take Dementia 101 in college. We didn't take Caregiving 101. And for many families, like myself, we were kind of just thrown into it and tried to figure it out. And dementia is one of those really hard to figure out diseases because it's different in every person. It's not always the same. There's some similarities maybe, but it reacts differently and it doesn't follow a straight line either. You know, it's not like, okay, you've got a dementia diagnosis today and you just go down this straight path towards the end. No, it winds and curves. And today they're just fine. And tomorrow they're, not making any sense at all. So, so it is a challenge for families and trying to figure out what to do with all of that. And there's a lot of emotion involved too, right?
It is, because you're going from a child, I mean, even though it's a grown adult child who had a parent, and now the roles have a tendency to be reversed. And it's difficult for the adult family member to suddenly become like, well, now I have to now help my mother or father with this. And when it comes to behavioral disturbances, whether there's anger, crying, confusion, it's like you said before, we're not trained in how to deal with people with a brain injury, which is what is happening to the brain with someone with dementia. It's becoming injured every day as the disease progresses. So you're talking about mental changes, and none of us, most people are not trained how to deal with mental illness. And it is, it's an illness within the brain. So it makes it hard to navigate and know what to do, and like I said, the roles have become reversed and it sometimes can be challenging.
Yes, yes. So I have a series of questions that you've given me that you kind of ask families when you talk to them. So let's just kind of go over these and talk about that. So one of the things that that you first ask people, of course, is what changes have you noticed with your family member?
Mhm.
So talk to me a little bit about that question and what possible answers families are giving you and how you help.
Okay. Oftentimes, I think the first one is this something that's happened recently, like within the last 2 weeks, or is this something that's gradual? There are normal changes that happen as a person gets older. You forget your keys. You might forget that person's name. Just the many of the effects that most people starting at around 50 start to realize, like, yeah, I forgot your name, or where did I put my keys? But then we find them, or maybe someone sends like a little hint of, oh, that was Jennifer. Oh, yes, and the memory comes back. Those are all very normal parts of aging. The thing that starts to transition over could be, say your loved one has keys in their hand, but they don't know what they're for. They don't even know that they are car keys. Those are some of the nuances that may be changed. Say your loved one is taking a medication faithfully for years, their blood pressure, diabetic medications, but all of a sudden they're becoming resistant to taking them. And sometimes the reasons can be unusual. Oh, I don't think I need them. I don't think that I don't have hypertension. I don't have diabetes. So those type of things are changes. Now, I usually, when you have something that's happening, a change maybe within a week's time, my first thing is to always take the loved one to the doctor. It could be something as simple as a urinary tract infection. Elderly people don't present the same way. Like if a younger person has, or a clear thinking person has a urinary tract infection, there are usually symptoms that you can say: burning upon urination, frequency. That is at least in my experience, that is not the norm. I rarely have somebody tell me that they're having problems urinating, or it's difficult, or it's painful. I get change of behavior, confusion that wasn't there, those type of things. So if it's acute, meaning that it's come on suddenly, it could be something like that, an infection. That's why when you first start to notice, I think the best thing is to try to have them seen by their primary care physician. They could run some labs. It could be a vitamin deficiency, it could be thyroid issues. So it's always good, if this is something that you're now seeing, let's try to get to the bottom of maybe an underlying condition that's not related to dementia. So that's usually the first step that I tell them.
Yeah, I think that's important. I think on the part about going to your primary care doctor, though, understand that not all primary care doctors are trained equally, and a lot of them know very little about dementia, and they don't always know to look for those other things that could be causing the problem. So you have to be the advocate if you're the family member.
Absolutely.
And having somebody like Gina in your back pocket that has a nursing background, has that medical background, can help you to have the information and know to ask the doctor, hey, could you check her for a UTI?
Yes.
Could you check and see if there's any kind of vitamin deficiency? How's her B12? How's her vitamin D? What's going on there? Let's look and see, especially like you said, if it's more of an acute situation, it suddenly came on. We want to explore, are there other reasons? And even with somebody that it's not acute, it's long-term, those things like the UTI can make the symptoms worse, right?
Absolutely.
Yeah.
Yes.
Yeah. So you want to know how long the situation has been occurring. That's really important when we're talking to families. So also you ask, what is the person's baseline and how was it altered? What do you mean by this?
For example, if your mother may be living by herself, if she's always been very clean, if when you have visited her home, apartment, as things have been put away, the dishes, she seems to be managing on her own. That could be an initial baseline. My mother is very neat. My mother puts things away. My mother makes her bed every day. But now, as you've been going over to see her, it may be that there's piles of papers everywhere. Things, you might notice some confusion. There could be scattered, say, bills or paperwork that used to be organized as now looks like it's scattered maybe on a table or on the floor. Maybe you're going over now and you're seeing dishes in the sink, or beds never made, or the bathroom is dirty. That's an alteration. That is something that is beyond. The baseline is just like, that's the person's normal. This is my loved one's normal. And now how am I seeing changes within them?
That is a really good one, because I noticed that was one of the first things that I started noticing with my mother-in-law.
Mhm.
She was super neat. I mean, everything had its place. Everything always looked great. She was an interior designer, so she was really all about the visual.
Mhm.
And I started noticing, I would go over to her house and it wasn't quite as clean. And even though she had a housekeeper that came in, there were papers everywhere. Like you said, piles of papers, bills, and things like that. It just wasn't her, it just wasn't her.
Mhm.
And I think that's one of the biggest things that families can pay attention to, because we know our person, we know our loved one, and we know, like you said, what their baseline is, what their norm is.
Yeah.
And if suddenly it's starting to change, or over a period of time, you notice that it's really changed a lot, then, that's something to be considered about. Now, that said, I myself am reaching 65 and I just don't like to do as much as I used to do. So there is some of that too. So you have to kind of look at it with a careful eye,
Mhm.
and not jump to conclusions, because somebody is not always making their bed and they used to always make their bed. Maybe they're just tired of making their bed, but look at kind of the overall picture.
Mhm.
And see. Yeah, I think that's important. So you also had a question. Has your family mentioned they know something is altered with their day-to-day life?
Yeah. Some people are able to articulate to their loved one something, and it's not all that common, because when a person knows what dementia is, it could be quite frightening to think that, could this be me? But it's sometimes family members are able to say to someone that they know and trust, I'm noticing something different. I forgot I was out at the store the other day and I couldn't remember how to get home. I was out to the store and I suddenly, and I'm concerned, so it's, if we're lucky that if your loved one can mention that, the next step again is always the first step should be to see their primary care physician. But it's usually I can't find something. I noticed that I used to love to read, and now, gee, honey, I used to love to read, but now I'm noticing that from page to page, I can't remember what was on the previous page. Just sometimes those signs can be small. Say you're over and maybe your loved one your family member is having a hard time remembering how to cook when before they loved to cook. So, there are times where they will tell you their concerns, and take them seriously if they are talking to you about it.
And that's important, because a lot of times, especially the adult child, doesn't want to hear that. We don't want to know that there's a problem. We want everything to stay the same, and mom and dad to be just like they were. And so we tend to sometimes shove that under the rug, and it's important to pay attention. I know with my mother-in-law, she didn't really confide in her sons, but she would confide in me.
Okay.
And she would tell me, because we were more like best friends. And she would tell me, hey, I got lost today. I was lost for 3 hours, and, blah, blah, blah. She would never say anything like that to her sons. So who in the family has that type of connection? Because sometimes they want to protect their children. Especially a mother will a lot of times want to protect the children. And a lot of times the men, I notice, they just want to keep their control, and they want to feel like they're still in control. And so it's hard. But if they're saying something, you need to pay attention to that. That's really important.
And I think you're right about, I've taken care of a lot of men with dementia in the beginning stages, where they are coming into my facility and they are very vocal about their sadness and frustration. These are this generation, they are the men of the house. They were the ones that they worked, they provided for their family. One of the sad things, I had a gentleman that said to me one day, He says, Gina, I'm a non-person. And I asked, why do you say that? He said,
Mm.
I can't even live with my wife. My wife sold our car and I had no part in it. And he was so depressed, and
Oh,
it really
wow.
broke my heart. And I find that a lot of men, I mean, these are strong men who are
Mhm.
now needing more care, more,
Mhm.
more day-to-day care. And it is very hard on them.
Yeah,
It can be quite heartbreaking,
yeah.
because you see such a depression setting in, because they realize that the changes that they're going through and their lack of ability to still, even they're married 50 years and they can't take care of their
Mm.
wife anymore, and
Right,
so
right.
it's
Well,
difficult.
for many of them, they were raised that that is their job. That
Yeah.
is what they're supposed to
Mhm.
do.
Yep,
And when you take that away from them, they don't know what they're supposed to do.
exactly.
And
Very
that's
hard
hard.
transition.
Yeah,
Mhm.
yeah.
Yeah.
It's a tough disease.
It is. It is. And
Yeah,
that's why, it's hard for the person who's seeing the changes to be able to accept it,
it
because,
is.
dementia has been brought to the forefront. A lot of people know, what's coming. It is a degenerative and fatal disease.
Mhm.
And you have your grown children that are like, this is my love, these are my parents, my mother or my father. And
Mhm.
this is what, life is going to change now. And it's unsettling. So,
Mhm. It is. It is. So, one of the big questions I'm sure you always ask is, have you noticed any personality changes?
mhm. Yep, it's pretty common for one of the early signs is for your loved one to act differently, whether they were, maybe a very calm person, very slow to anger, and suddenly they're getting angry very quickly. And even on the flip side, I've had my own, in my family member who started out to be more of a stronger personality, and suddenly change, and he became a lot sweeter, and definitely seeing the
Mhm.
changes as the dementia progresses.
Mhm.
Depression is something that is, while it might not be from dementia, that could be something that you could be looking into as well, because someone could be suffering from dementia and it could appear as if they're starting to have dementia symptoms. So
Mhm.
any of those things, would be need to be looked at by the PCP.
Right, right. So, if you're noticing personality changes, you
Mhm.
recommend going to your primary care physician.
Mhm.
What if the primary care physician says, "Oh, everything looks okay," but you still suspect that there's some problems?
I
What
think
then?
I think once the initial tests are done, lab work, again, urine, when I was in nursing school, they taught us if your resident blinks the wrong way, check their urine. That's how common it is. And
Mhm.
that's how quickly you'll see changes within them. But if the initial lab work is all complete, thyroid, vitamin levels, and things like that, if they're complete and come back clear, then I would suggest, getting a referral to a neurologist and have them,
Mhm.
evaluate your family member.
Mhm. Okay.
They
All
can do
right.
cognition tests to kind of pinpoint what's going on.
Right, right. So this is a big change for families. Dementia doesn't just affect, or really any disease doesn't just affect the person who is living with it, but the whole family is affected. But especially so, I think, with dementia,
Mm-hmm.
because it is such a long disease process often,
Yeah.
and it's a very still misunderstood disease.
Mm-hmm.
So I'm grateful that we have somebody like you in this
Thank you.
world, and I think what you're doing is great to be able to go into people's homes and help them navigate those changes and understand what's going on, understand why dad's following me around all day, that it's
Mm-hmm.
called shadowing, and what can you do to maybe get a little relief from that, and what you need to do to take care of yourself. So all of those kinds of things are so important. Gina, if somebody wanted to contact you, how would they do that? Should they go to your email or your phone number?
Yes, they can do. My email is dementiauntangled
And
at
I'll put it up on the
gmail.com.
screen.
Yes, and feel free to use that phone number as well.
Okay. Do you want them to text or call?
Feel free to do either. That would be
Okay.
fine.
All right. So you can text or call Gina at 936-777-5161, or you can go to her email, and that's dementiauntangled@gmail.com.
Yes.
And if you're having some challenges and you don't know what to do, maybe it's time to bring in a consultant like Gina to sit down with your family and figure out what are the next steps and how to manage day-to-day life. Like you said, keeping them at home as long as possible is the ideal.
Yeah.
It doesn't always work.
Right.
As we all know, but if you can make it work for a while, that would be great.
Yeah. And if I could say as well, and it's like, again, I've been doing this for a long time. When I first started working as a nurse, it was difficult for me to see. I've done skilled, those are the people with dementia that need actually more care. And I've done memory care and assisted living where maybe they're in the beginnings of their process. And oftentimes the families, and yes, it's a serious disease, but I find that if I can help family members to find, believe it or not, joy within the process, joy within smaller things, it actually made me enjoy my job more, because you do have to it is a change of mindset. It is we're going to enjoy this right where we are. And it can be difficult for family members because they're used to mom and dad, or their spouse as they used to be. And now things are different. And I try to, even within my own self, working with my residents every day, I try to find the joy in just the smaller things, because they can be very meaningful. And I do know that, a family member, once they and I think the biggest issue is if you understand what's happening to the brain of your loved one, and you really understand what's going on in the brain, and you can understand that it is a brain illness and not, a person, it's, oh, my mother's just being ornery, or my mother's just, it's an actual disease that is affecting the processes that are going on in the brain. And if you can accept that and just say, okay, now this is our new normal. How can we possibly find some moments of enjoyment and memories through the process that will be comforting to us as this continues? So I do love to teach my family members that. So.
That's great. And so needed. Gina, thank you so much for coming on the program today. We really appreciate it.
Thanks.
All right, everybody, we will be back in 2 weeks. Thanks for showing up. Thank you for joining us on the Life After 50 show, where we help you navigate the second half of your life. Join us on the second and fourth Wednesday of each month at 10 a.m. Central Standard Time on Facebook or YouTube. And be sure to visit findhoustonseniorcare.com, where you can find all the replays. Make sure you also visit senior-conference.com for more wonderful programming.